Very good. Well, welcome. Thank you for joining us on what I thought was going to be rainy, so I'm happy Wednesday afternoon. We're really excited to have you here. I'm Liz Isaacs, and I have Shannon Quinn Sheeran, my great coworker, and the two of us are going to do our very best to talk to you about the balance of state, or you're going to hear us call it BOSS. And we're just really excited you're here. We're always thrilled to be bringing new folks into the fold with us and into the madness that is this world of HUD and the state and BOSS and all the good stuff that we do. So thank you again. Thank you. And just housekeeping things, we feel really strongly that we want this to be useful for you. So if we are going too quickly, too slowly, we're boring you, please raise your hand, please chat, stop us at any time with a question. There are no dumb questions, literally, in this world. The acronyms, the relationships, right, Shannon? Shannon and I have to ask other questions all the time that we're like, shouldn't we know that? Should I know that? And there's just none of this. So please, there's nothing you can ask us that will, is dumb. And that thing they told us in elementary school, if you have the question, somebody else does too, probably. So you're doing everybody a favor. So we have a lot of slides here. We actually think that's too many, and it's, Shannon, I didn't want to call it dry. What are we calling it?
There's just a lot of minutia in the world of HUD. There's a lot of little tiny details to know. And
yeah, so we wanted a place where it was all captured, but we're not going to read the slides. And some of them we may breeze by, but we hope that you have this as a resource if you have a question. But Shannon and I are always your resources, and everybody else on our team, we always want you to email us, call us, and say, what's going on? I read an email. Do I do something? Does someone? And that's all normal, natural, and welcome. So that's our caveat for what we're doing. Here is our agenda. We're going to do some breakout rooms, so everybody has a few minutes to just get to know who's on the call. We're going to do an overview of CT BOSS, so you have a sense of what the heck BOSS is. We have some new stuff to tell you about from BOSS. We're going to talk about the components of the homeless service system. We'll talk about all the different partners, responsibilities of Continuum of Care projects, so folks that are receiving COC funds, what they need to be doing, what we hope are some helpful resources. And some learning opportunities, what's coming up that you might want to find out about. I know recently I've gotten a bunch of emails from CCH. And so if you haven't signed up to get their trainings or their newsletter, that's always good to do and easy to do. So I think we're going to do some breakout rooms. And Shannon, do you want to do the next slide? So just if you can introduce yourself, say whatever you want, or say very little, your name, that's fine. And then you guys can answer the question.
This slide, right?
Oh, no, the one before. Yeah. Do you prefer summer or winter, and why? Right, profound questions we have here. We're trying to, keep it simple. At 3:30 on a Wednesday, I don't have a lot of brain power. Okay, so I'm going to break you out just a couple quick minutes so that you can see who's in your room, chat, and then we'll bring it back. Other. Yeah. And you are going to have to respond.
You have to click join the room. Liz, do you pause the recording during these?
Oh, okay, I will. Thank you. Thanks, Shannon. Heated debate.
The rooms will all be closed.
Yeah, 2 seconds.
Yep.
There you go. Okay. So what was the consensus, summer or winter? Someone tell me.
Or throw it in the chat.
Or throw it in the chat. Yeah, what do you say? I mean, I think it's a no-brainer for summer, but that's just me. It's been a long winter, I think.
Yeah.
I think most of us chose summer also.
Excellent.
There.
Good. Well, it's the right choice now, right? So hopefully, I'm knocking on wood because it's Connecticut. We know it can snow early April, but hopefully it won't.
Okay.
And we're moving in the right direction for spring and summer. So good. And did folks get to talk to some people that you hadn't met before or new people? Good. I see nodding, smiling. Good. It's nice to connect about something other than work, right? So great. All right, well, we're going to keep moving. We're going to welcome some new steering committee members, which is really exciting. We have new community representatives. And so we have Natalie, Teth, Diamond, Richard, and Lisa, and we have new CAN representatives, Kathleen and Caitlin. And just so folks know, the way we do CAN representatives, and the CAN is the Coordinated Access Network, is that the CAN itself designates who that representative is. And so sometimes they switch it up. So these are 2 new reps for these 2 areas. And then in June, we will sort of re-up folks have another chance to do all the paperwork and register reps to be on the steering committee. Okay, next slide. So this is our idea for today, but I put a note on here that if we've missed something or if there are other things you want to know about, please raise your hand or unmute yourself or put it in the chat box because we'd love to address anything you'd like to hear about related to BOSS. But we're going to talk about the responsibilities of BOSS, what are the components, who are the partners and what are they responsible for? Again, what are COC projects responsible for? What are CAN and community reps as steering committee members responsible for? And then if you want to know even more than that, where you can find some resources and information. Okay. Next slide. So I don't know. Shannon and I were trying to think about fun facts or amusing anecdotes we could tell you. And just really quickly, we could talk a long time about it. I won't talk for a long time. But the reason BOSS is called balance of state, BOSS, is because once upon a time, the balance of state was just a few little communities that had cobbled together the money that kind of was on the table that nobody was using. So HUD looks at a map of Connecticut and says, East Hartford gets this much money and Hartford gets this much money and Glastonbury gets this much money. And each COC that was created kind of puts together the towns, and this is back in the 90s. And so any towns that were left out, that weren't part of kind of the bigger COCs, Demas and actually our boss worked together to kind of put those together so that they could ask for that money. And then through the years, balance of state just had other folks who were interested in coming together, having some economy of scale, because it's a lot of work what the COCs do. So Hartford joined and New Haven joined. And so what was once a dozen COCs throughout the state of Connecticut came down to just 2 COCs now. So balance of state is fully a misnomer, but we're not renaming it because balance of state is the entire state minus Fairfield County. So Fairfield County has its own COC and they are ODFC, Opening Doors, Fairfield County. So you hear us talk about them and we have a nice working relationship with them. And, you know, it's a small state, we all know each other. But so keeping that in mind, BOSS doesn't really make sense as his name, but we're not changing it. But that's a quick history of what was really just a very small pot of money that we got from HUD is now $47 million, and the majority of the state, which is exciting. So that's as amusing as I can get. So you're going to keep hearing us say COC. What's a COC? So a COC is a group of people who come together from the public and the private sector to work to prevent and end homelessness. It's important. You cannot get money from HUD if you don't have a COC. So you have to have a COC to get HUD funding. And the most important, I mean, that's an important thing, but the most important thing is that people are coming together to plan, to figure out how to use the resources that do exist, and to hopefully prevent and end homelessness. And I already talked about the 2 COCs. So next slide. So key responsibilities, really big important thing is to fund projects and to ensure that projects that already exist are compliant, are doing what they're supposed to do, and then every year get their funding. We want to use data and try to improve system performance by looking at the numbers. We always want people, like I said, to know what the local and federal requirements are. Compliance is really important. You'll hear us talk a lot about it because projects that get COC, that get HUD funding, are required to do a lot of things. And we take very seriously helping projects be able to meet those requirements, because if they don't meet the requirements, they cannot get the funding. And if they can't get the funding, they can't serve the folks that they're serving. So that's a big piece of what we do, is try to support the projects so that they can continue to get funding and continue to do the fantastic work that they do. You'll hear us talk a lot, and I should have put it in here, but about a NOFO, is a notice of funding opportunity.
That's the next slide.
Yeah, oh, I'm sorry, it's the next slide. If I had my notes moving, I would have it. But that is the application that we submit every year. So we call it the NOFO. We'll talk about it on the next slide. And that's a huge piece also of what the COC is responsible for doing. And we'll talk later, but about housing innovations where we work, that's what we do for what used to be 3 months a year and now feels like 12 months a year, 12 months a year. And we also want to make sure that we have the CANs are working, the coordinated access networks, that the homeless management information system, which we'll talk a little more about later, that's working. And that every year we do a point in time count of counting people who are experiencing homelessness, that's done, and that's done as accurately and completely as possible. Okay. Next slide. I'm going to stop just one sec because we have, can you tell? Yes, we're going to talk about the competition. Yes.
That's good timing because that's
perfect timing. I love it. People are listening. Yay. So HUD awards every year about $2.5 billion nationally. So throughout the whole country, that's about how much money is out there. And COCs compete with each other for that money. So I don't know how many COCs there are, but there are many.
I just think there's over 400 in
over 400
country.
COCs. So we're all competing for what really is not a huge amount of money, given the need, but that's what we're doing. When we apply each year, there are the COC submits an application, and then projects submit applications, and it's all done through an electronic system called eSnaps. So the COC application requires us to write about all the good work that BOSS is doing. The project application, some of you on the phone or on the call may have experienced the project application, which asks about all the details of your project and what your goals are and what's happening. And then we also have new projects that are selected through an RFP process every year, where we decide the steering committee decides which project types, permanent housing, transitional housing, or permanent supportive housing, rapid rehousing, should be funded. And then we ask for folks to submit applications to us, and then we submit them to HUD. And we also do a priority listing, which is a ranked list of all the projects that are submitted to the COC. Questions, comments? I see Shannon's answering some stuff.
And I just, based on the score that the COC gets, we may or may not receive new project funding every year.
Yes.
That's how that's determined. And based on the availability of new funding.
Great. We're in the weeds a little here. So this is one of the slides that I'm just going to stay very high level, which is HUD has a whole system of ranking projects, and there's math and algebra and all kinds of terrible things that have to happen for us to create these different tiers. But I'll just tell you, BOSS has really philosophically always wanted to ensure that renewals stay funded. And that the folks who are already funded, already serving people, continue to get their funding. We'll talk not today, but another time, if there are problems and projects aren't performing, Balance of State does have a process for that. But in general, Balance of State really likes to ensure that renewals continue to get funded. And so when ranking comes up each year, we're always thinking about that. And then, yeah, the competition has just gotten tougher and tougher every year. Like Shannon said, over 400 COCs that need money. So it's gotten harder and harder, and there have been more requests for money. As HUD continues to fund renewals, more and more money is needed, and it means there's less money for new projects, unfortunately.
And HUD has changed up how they score some also in the last 5 years or so. They put an increasing percentage. COVID has mixed it up a little bit, but they've put an increasing percentage of points that you get from your system data, which we're going to talk about in a little bit, but things like system performance measures, or your PIT count, how many people are experiencing homelessness in your area, really matters a lot in terms of your competition, your whole COC competition score, and then your ability to get new money.
Yep. And I'm not seeing anything new in the chat, but please let us know. So I mentioned this before. So BOSS received 47 million a week or two ago. We just heard about the announcement. And then Fairfield County, so the other COC, got about 16 million. So for the state, we have about $63 million in HUD COC funding. And I won't read these or list this, but these are the activities that are funded, and we're going to talk about some of them in the next couple slides. Okay, next slide. So we wanted to let you know, so you get 47 million, where is it going? So as you can see, permanent supportive housing is the bulk of it. So permanent supportive housing, which is a rental subsidy, services available to folks, and it's not time limited. People can be there forever. The idea is if folks are ready to move on, that they do move on if they choose to. But people can be in permanent supportive housing forever. And then rapid rehousing takes a big chunk. So rapid rehousing is a shorter intervention with fewer services. And I should say, I'm sorry, permanent supportive housing serves people who are living with disabilities as well. So you need to have an eligible disability to live in permanent supportive housing. A little slice of transitional housing, we don't have a lot. We get a planning grant, which helps the whole system and the planning work that we do. And then you can see the other much smaller pieces. But the big takeaway from this is permanent housing, whether it's rapid rehousing or permanent supportive housing, make up the bulk of what is funded by HUD for Balance of State. Anything else? And then just so you know, so we had about 95 renewals, and they were all funded. So that's what we like to see. And then there were some new projects, some services only, some things to support the coordinated access network, and then some new DV money. So I think that's it. Okay, next slide. We just wanted to give you a picture, which this is not up to date yet for 2022 because we're in the midst of still number crunching with our partners and looking at the data from the 2022 count. So these are the data from 2021, and this is for the whole state of Connecticut. So this is what's happening in Boston, what's happening in Fairfield County, entire statewide. And you can see that overall numbers have gone down from 2020 to 2021. Numbers went down. Numbers went up slightly for unsheltered from 2020 to 2021. But Shannon, correct me if I'm wrong. It looks like we're coming back down on the unsheltered number for 2022.
We are, at least for Boss, we are, yes.
For Boss, we are, yes.
Mhm.
I'll pause there for a second. Questions, comments? Yeah. All right. Are you taking over here, Shannon, or am I going to keep going?
Oh, good question. I can take over.
Okay.
Is that what the plan? I'm taking over now? Okay. All right. What's new? Part of when Liz was talking about what makes up the COC is representation. So part of and ensuring that not only all sectors like nonprofit, employment, benefits, those are represented, but the people who have experienced homelessness, that population is also represented. So we're doing some new and exciting things in that regard and helping to improve our services from that vantage point, which is really essential. So new and exciting, now providers have direct access to HMIS data in real time. This is for our renewal evaluation process. There's going to be a procedure that's being launched next week, actually, where all providers are going to be able to see the data that's used for your renewal evaluation and the scoring in that in real live time. And the plan right now is for that to open next webinar on that next Thursday, and then for the database to open shortly thereafter.
Yep.
We also have a new policy on ensuring safe, healthy, inclusive, affirming, and discrimination-free environment for LGBTQIA that population. So the policy and all of our policies are listed on the CT Boss website, which can be found at ctboss.org. And we're really excited to include this as a part of our COC. Encouraged all individual projects to adopt a similar policy. Next, we've really gained ground in consumer leadership through the CLIP program, and we talked about welcoming some new CLIP representatives who are with us today. So we're very excited about that. So CLIP stands for Consumer Leadership Involvement Project. It's coordinated by the Corporation for Supportive Housing, CSH. And the goal of CLIP is to increase the quality and the quantity of involvement by persons with lived experience of homelessness. Activities that CLIP involved in CLIP are focus groups, steering committee trainings, ensuring greater inclusion of people with lived experience of homelessness in the steering committee structure and in decision making. And there's a contact there for everyone if you want additional information on CLIP. Kia at
Yep, Kaya, and Kaya's actually on the call.
CSH.org. And I think is she with us today?
Yes, I'm here.
Yeah.
Yeah.
Thank you. Is there anything additional you'd like to say about CLIP, Kia?
Other than Kaya's, but
I'm
other
sorry,
than
Kaya.
no, I'm just super proud of our team. So I just want to, other than just lifting them up and really sharing with you all how great and amazing and hardworking the CLIP cohort has been. Yeah, I just want to share that with you all. Some of you have gotten to have more intimate conversations with the cohort, but for others who haven't, please schedule some time. Like, we are open to having more intimate conversations and asking questions. So I do encourage folks to set some time aside to meet Clip outside of the larger meetings. I do want to lift.
Well,
Thank you. Was there somebody else who was wanting to say something? If you're not speaking, could we ask you just to mute? There's a little static or something on the line. But again, if you wanted to say something, feel free to unmute yourself.
Yeah.
Thanks again, Kaya. We're so glad that you're here, and we're really happy and excited for the work that you all are doing. On that same vein, we have an increased number of people with lived experience of homelessness on the steering committee, community representatives. The steering committee is now comprised of at least 2 and up to 6 community representatives. There is one caveat: the community representatives may not be employed by any agency receiving COC funds. So to keep conflict of interest as clear as possible, that's the regulation there.
So in the government document, it notes that we have from 2 to 6, but we're lucky enough to have 6 community reps now. So that's great.
We have an increased number of BOSS steering committee co-chairs. We used to have 3 and now we have 4, including state government and nonprofit. So the makeup of the steering committee co-chairs, a minimum of 2 co-chairs self-identify as one or more of the following. And you can see those are populations that are underrepresented often. And this is an effort to increase inclusion and raise up the voices that need to be raised up in our community. Again, if at any point anyone has questions or something you'd like to contribute, please feel free to raise your hand or throw something in the chat and we'll pause and give time to that. I'm going to move on to the core components of our homeless services system. So kind of from start to finish, if somebody has an experience of homelessness, although we know it starts way earlier and there are many factors that go into it. But in terms of BOSS's system, it starts with 211. If we know somebody is experiencing homelessness, excuse me, 211, either the phone number or the website, is a one-stop connection to local services. So they're the front door to our homeless services system. It's where people should call to get assistance. It's currently run by the Connecticut United Way, which is funded by Department of Housing. For more information on that, see the links on the slide. And we'll talk more about how 211 works in combination with the CAN system in upcoming slides. These are the CAN regions. So you see how Liz talked about the Fairfield CAN is in the Southwest, excuse me. They are not a part of BOSS, but they do have their own CAN. The Greater New Haven CAN, Meriden, Middlesex, Wallingford. These are just regions, hubs, where there are individual groups that come together to talk about what homelessness looks like in their region and find solutions and refer people to the appropriate projects. And then each of them has representation on the steering committee. So we wanted to take a poll of everybody, and I feel like maybe just either shout out or put something in the chat box about what coordinated access network you all are in, the people who are on this call. So I'm going to go back to the map in case y'all need a reference.
Great. Oh, we maybe have all the CANs represented. It's very exciting. We have Greater Hartford, Litchfield. So that's the
Greater Hartfield.
Very Litchfield, but Northwest CAN, right? Oh, good. Fairfield's here. Central. Excellent.
Waterbury, Eastern.
Central, oh, excellent. Good.
This is Florence from Willimantic. I have Northeast, Southeast.
Fantastic.
Eastern,
Thanks.
yeah.
Nice to
Yeah.
have you.
Northeast, Southeast combined into one in
Sure,
recent
yep.
years, I believe. Yeah.
Oh, that's great. Well, we have the whole state represented. Fantastic. Thank you. And you guys all know your cans. That's awesome. Everybody good?
Yeah, thank you.
Thank you.
Thanks for sharing that. So I'm going to talk a little bit about the CAN system here. It used to be that finding housing for somebody experiencing homelessness was kind of a free-for-all, and you were kind of you got the luck of the draw based on where you showed up on any particular day and how Southeast and South, yes, Northeast are now the Eastern hand, yes, thank you, Sage. But depending on where you showed up and what the agency, how well the person you were seeing that day was doing their job or not, and how well connected they were, even maybe whether they were new or whether they were 10 years in and had a ton of connections, was how well your chances would be of finding housing and how quickly you might find housing. And then HUD came along and had requirements for COCs to develop coordinated entry systems where it gives people more of a fair, an even shake, even opportunities to find and access housing that was appropriate to them. So the people, it used to be the people who were most likely to get help would be those who had a case manager, again, who had been around for a while, those who were the best self-advocates and could jump through a lot of hoops, background checks, drug screenings, interviews, even credit checks to get where they needed to go. And some case managers would teach people, this is the thing you need to say in order to get into this program. You have this type of mental health diagnosis, or you are unable to live on your own with, there are different key phrases that people might have to say so that they could get into certain programs. It really was not an ideal system. So coordinated access networks were our answer to HUD's requirement for a coordinated entry system. And it's way more fair way of accessing housing. So this graphic shows what CANs do. So what they do is they know which program exists in their area, what each program provides, what population each program serves, and where and when there are vacancies. It can help ensure people who need help know to call 211, know how to access help. It uses a standardized assessment to determine what people need, what type of housing is most appropriate for them. It helps as many people as possible to tap all available resources and avoid going to shelter when possible or being on the streets. The CANs keep by name lists of every person, every household who needs housing in their area, and they prioritize those lists to based on a variety of metrics, including how long the person has been homeless and who has the most intensive needs. And CANs work together to find creative solutions and keep people with tons of barriers housed. Any questions on the CANs? Or anybody experience CAN and want to talk about their experience of a CAN? Katie, did you want to unmute yourself? Do you have a question?
Yeah, I was going to put it in the chat, but I'll just ask it. Are there any thoughts from the Balance of State folks about how homeless people with limited access to time on their cell phones and battery life can access 211 without hours of wait time?
That's an excellent question. Yeah, so limited minutes is an issue for a lot of different things, CANs and access to housing being one of them. like I have the standard responses like access your library and their computer system to send emails, or if you're able to actually get somewhere and not need a phone. Melissa's adding something. Google Voice cannot access 211 and it's free cell phone services. Okay. Liz, do you have any additional ideas?
I don't, and what we will certainly, and I don't want to give the bureaucratic response, but we'll certainly note it and bring it back to the group. Does anybody else have any suggestions or things that they, strategies they use with clients on this?
I definitely will bring people to my office and, just not use their cell phone, but use
Right.
my office phone. And I have a way to get through a little faster myself. But for
Yeah.
folks just out there who aren't going to come to somebody's office, their explanation to me 99% of the time is that they don't have the time on their phone or the battery life.
Yep.
I
Hi,
do-
Liz. I can share a little bit because I actually worked at 211 in their call center when the CAN
Okay.
was working. A couple tips that we can share is that there is a dedicated line, I believe, if you press housing and it's 3. Or if you don't have the time right then, you can push option 1 and that's the crisis line and they can transfer you in queue to the housing. Also, 211 is 24/7. So if they can't get through during the day, they can call at nighttime. I know this may sound a little weird, but they can call at nighttime as well. It's always staffed 24/7. They may not necessarily have the housing, but what they do is take the information, and when the housing team does come in, they can take the information and call back as well. So there's a couple things that you can do to kind of circumvent it. But if you hit crisis line, they will take your information, they will transfer you in queue.
That's
Thank
great
you.
information.
Thank you, Nicole. That's helpful. Anyone else?
I know that if people experiencing homelessness are connected to outreach, an outreach worker can help facilitate or help call somebody using their own cell phone.
Right. I think Annie was going to talk too. Annie,
Okay,
do you have
great.
a suggestion?
Yeah, I don't have a question, Liz, but thank you. I just wanted to acknowledge, maybe I'd love to update this workflow sometime, because I think it's important in Connecticut that we do have, within the system, we have a way for anyone who's a victim of domestic violence, who can access the system without having to go into the system by name if they need to. So I just think it's like, it's have that. So I think it's important to acknowledge that if people are victims and they can't put their name on a public list, that we do have a system in place that starts with our statewide DV hotline to get people to these resources on the by name list.
Annie, that's great. And what we'll do is I'll reach out to you either for if you have a similar graphic, or I know we have some things, and I will add a slide to make sure that that phone number is there and that information is there, because that's really helpful. Thank you.
Also, Annie, if you have that 800, if you could put the number in the chat for everybody, that would be helpful for now, but we will do those other things.
That's great. Thanks, Annie. I see James has a hand up. James, did you have a question, comment?
Thank you. Yeah, thank you. I hate to be the dark cloud on a sunshiny day, but my experience with the cans was a little different than how this flow chart describes. It was a couple of years ago when I first arrived to Connecticut, and I actually got housed in a shelter within a day or two of arriving in Connecticut, which was great. I was in the Hartford can for 9 months, and not once while I was in the can had I ever did a housing interview, was told about housing, or was introduced to, a path to housing. My interpretation from the staff was that I should be glad that I have a bed in the shelter. Now that being said, I did become homeless after I got kicked out of my school housing. I did become homeless a second time. At that point, I was still in the Hartford can, and they couldn't give me any. I had to be in an emergency warming center. And at that point, I went to the Middlesex can, where it was like night and day. I was in a warming center, then went right to a shelter, and within 6 months, I was in my apartment. So I brought this up at our clip meetings, but I just want to let you guys know that my interpretation is that there's a lot of difference in the cans throughout the state. And what I got done in 6 months in the Middlesex can, the Hartford was not helping me whatsoever. And being a student and all and having a plan, I could not execute that plan in the Hartford can. So I had to move. I'm very happy with my people that I'm with now and my support mechanism. But I just want to throw that out there because, people lived experience. They have a lot of different things they can contribute. And my thing is that the staffing and the objectives may not be uniform or throughout the state. I want to throw that out there.
Thank you, James. We're going to write down your feedback, but yes, you're absolutely right. People with lived experience have invaluable contributions, and this is important information to know so that we can continue to try to improve the system and make the cans more equitable, right? And people have equitable opportunities no matter where they experience homelessness in Connecticut.
Absolutely. I see
Yeah.
Verisak has a hand up.
Yes, hi everyone. Just wanted to give some feedback, and it just happened actually. I just finally got in touch without naming the person. Just I could, but doesn't matter. It's more. I got in touch with an outreach worker, and the title I have is called Outreach Case Manager. So I think what's the program that they enter in? Is it called PATH or something? You guys know?
Yeah, yes, it's a
Okay,
outreach
so
worker, sure, could be.
great. So I'm so blessed to be a part of CLIP, and but even being kind of knowing some of these words, I just wanted to give feedback that if I was an outsider, like it would have been nice too when I left the office if that person, it was more like an official trip to the DMV or something where either you get an email or a printout of, hey, here you met us and here's the next steps.
Yeah.
It just felt like it's more like, hey, take my word for it, like we'll be in touch, which is fine. I'm not doubting that I'm gonna be forgotten about. It's just more, it would feel, coming from someone who this is like the last lifeline. Like, oh, it's like, it'd be more reassuring for the individual if you were handed, like, got an email or a document saying, hey, this is the step,
Yep,
and this is the next steps. I don't know. I just think that would be a lot helpful. So some feedback to give back.
I think
To
that's
you
really
guys.
helpful feedback. That makes a lot of sense. And
All right.
we'll note that. Thank you. Thanks for
You're
sharing.
welcome.
Thanks, Mirsa.
Okay. All right. And just I think just a reminder, if anyone's not speaking, to put yourselves on mute. Somebody just put a note they're having trouble hearing with some background noise. Okay. Thanks again for comments and questions and sharing your experiences and providing feedback.
Yeah, we are taking notes and we have the chat saved as well. So if you're giving us feedback in the chat, we will have that to share with the whole group. So moving on, the core components of a continuum of care, a big part of what we do, it's not actually the work that we do, but it's how we track the work that we do, is the Homeless Management Information System, or for short, HMIS is what we call it. So putting data in HMIS is a requirement for all COC and ESG, Emergency Shelter Grant funds. And ESG funds go to a lot of shelters in our area and some rapid rehousing projects as well. It is a state, the HMIS that we have in Connecticut is a statewide database. CCEH, it receives the grant for HMIS in our in our state, and then Nutmeg does a lot of IT support for us, for our region, to support HMIS and data entry. So programs are required to input demographic information on people, which helps us keep track of how long people have been homeless, how long they are in projects, and then it gives us a little snapshot of how people are doing once they're in a project. And we keep track of some people's income, for instance, for COC projects, to know if they are progressing and moving towards more housing stability, that an income would be a marker of. So the CANs use the data to see how many people are experiencing homelessness, and helps coordinate services. System performance measures, we look at the whole system, which we'll talk about in a little bit, and determine, again, an average length of time homeless, whether people are increasing incomes, whether people are returning to homelessness after they've been in some of our projects. We keep track of the point in time count and the housing inventory chart, which we'll talk about in a little bit, in HMIS. And HMIS is a system that allows projects to submit annual reports to HUD talking about their performance. And it's the data that we use for renewal evaluations, which is the process that we use to rank each program in the HUD competition every year. We're going to talk about project types, and Liz, when we looked at that pie chart, touched on all of these different project types that are supported through COC funding. Permanent supportive housing is housing with the most supports in our COC. It's targeted to people who've been homeless the longest and who have the most intensive service needs. In order to get into permanent supportive housing, you have to have a disabling condition as defined by HUD, which enables you to get into a supportive housing program with more intensive services. So the idea is people who enter CSH need supports in order to stay in their housing, and that the PSH program provides those supports to help people be as successful as possible and stay housed. Rapid rehousing, again, the PSH is not time limited, as Liz said before. Rapid rehousing is slightly less intensive, although it does provide supports. It provides quick access to housing through rental assistance and supportive services. People who are in these projects are their situations are reevaluated regularly to assess ongoing need. And this is time limited to 12 months or less, but exceptions are possible. Then transitional housing. Mostly in our COC, transitional housing is limited to projects serving youth or projects serving the DV population. It's temporary housing providing supports as well, which serves as a bridge between homelessness and permanent housing. The goal for transitional housing in our COC is to be there less than 12 months. And then when we say less than 12 months, the goal is for everybody to move out, to exit to permanent housing that can be sustained on a household on your own, or with a subsidy through another through another avenue. Then we also have supportive services only projects. These support our coordinated entry, or CAN process. We have HMIS grants, and we have COC planning grants, which support COC operations, planning, meetings, things of that nature. Some planning funds support our HIC and PIT counts as well. So YHDP projects, youth housing demonstration projects, are projects for youth aged 18 to 24. And in YHDP, we have these components: crisis, diversion, navigators, rapid rehousing for youth only, and the Connecticut Department of Housing is the YHDP lead. Use that link to get additional information on YHDP projects. I've seen some activity in the chat. Is there any?
Yes, so Teth noted that there is a need to make sure that funding can go to training for HMIS.
Yeah.
It helps workers. So it certainly can, and there is a lot of training that goes on because it is a critical need to make sure the data are correct and that workers have the data they need with the folks that they're working with so that they can do what they need to do with them. So yes, very good point.
Yeah.
Yeah, I
thanks,
just
Beth.
remember in another conversation, they said that access to HMS is limited due to the funding. Only certain people get access because the funding only covers a certain amount of people having access. So what I'm more saying is, how can we stretch the funding so more people can have access? You get what I'm saying? To like when I was an outreach worker, I had to wait to get access to the HMIS because the funding only covered a certain amount of people having access to it. So it wasn't until I advocated more and then I got access to it. So that's what I'm saying. If there's any way to advocate for that part.
Yeah, we can definitely take that back to the group as well. And we have heard recently there are requests for additional trainings or more capacity for trainings for people who do get access so that they could get it quickly and easily so that the work that they're doing can be tracked. So we will take that back to the group. Thank you, Tef. DV rapid rehousing, domestic violence or DV rapid rehousing projects and joint transitional housing rapid rehousing projects. This is funding that has come through DV bonus, which is additional to the COC funding every year. And we've had a DV bonus for at least the past 3 to 4 years, and we're never sure if it's going to continue to be the case, but we did get it this past submission. We received more DV bonus than regular COC bonus, and I believe that's just how the funding went. They had more available for DV. So we do have these projects specifically geared towards people who've experienced domestic violence. And the rental assistance for these projects is administered through CCADV. Annie Stockton Stabrowski, I'm sorry, Annie spoke earlier, and she facilitates the COC DV funding. Services are provided through 15 DV organizations throughout the state for that funding for those projects. So other additional components of the COC, which are really essential but not funded by COC funds, we're going to talk about those coming up. And we already did talk about 211 a little bit, but certainly that's an essential part of our system. It occurs at the CAN level. This is the prevention and diversion through 211. So it helps prevention and diversion, as the words say, help prevent homelessness at the very beginning of a housing crisis. They might help people find other resources. They might work with a person to mediate a situation between a family members where they came from. Will it help you if we provide some financial assistance to get back into a place that you were staying before where they just didn't have enough funds for an additional person in their household? Things of that nature that might be able to help with the utility payment. There are all kinds of possibilities to help prevent or divert people from entering homelessness in the first place. Again, connects people with services, financial assistance. DCEH leads the charge on prevention and diversion, and their contact information is at that link on the slide. Outreach is certainly another core component that I brought up earlier. It focuses on people who are unsheltered, and outreach works to engage people experiencing homelessness into services, providing housing navigation, some lighter case management. Engagement is a big focus for people doing outreach work. Projects for assistance in transition from homelessness, or PATH projects that we talked about a little bit before, serve clients specifically with serious mental illness, including those with a co-occurring substance use disorder. There's one PATH project per CAN, and that's funded by SAMHSA through DEMAS, through the Department of Mental Health and Addiction Services. Some communities have additional outreach, and DOH, Department of Housing, specifically received coronavirus stimulus funds going towards those additional outreach funding statewide. There's a link here to find out more information about PATH. Emergency shelter. I talked about emergency shelter primarily being funded through HUD ESG funds, Emergency Solutions Grant funds, and that goes through the Connecticut Department of Housing. It's also funded from other private sources. You'll find some emergency shelters hosted by religious organizations or things of that nature. Emergency shelters are intended to be short-term places for individuals and families with nowhere else to stay. One of our participants earlier talked about being in a shelter and not receiving any help in moving forward into a path towards permanent housing. But really the goal should be to receive the supports you need to move people in a direction where they can get permanently housed. So we're always working towards that goal with the shelters in the state and the CANs. There are, with the advent of COVID in the past couple of years, there is COVID specific funding for COVID specific housing resources. That funding has primarily come through the Department of Housing and from FEMA through Department of Housing. So with that, we've been able to put money towards hotel motel beds to help deconcentrate shelters when there have been times when people need to be farther apart, social distancing, or people need to sequester and not be around as many people. We've used the hotel motel funding. Unite CT is a program through Department of Health as well that provides rental and utility assistance to approved Connecticut households financially impacted by COVID. And then the CARES Act has been, that funding has been put towards peer support for vaccine hesitancy, homeless prevention programs, CAN support, rapid rehousing, and emergency shelters.
And Shannon, there's just a note, thank you for the update. Unite CT last month stopped taking applications. So
thank you so much.
Thank you so much. We will update that as a thing of the past, not a thing of the present. Thank you.
Thank you. Key partners, Liz, am I handing off to you? Okay.
Yes. So we've got lots of great partners. We can't talk about all of them, but we're going to talk about a few of them. So the next slide. So the first one we're going to talk about is Reaching Home. So many of you may know Reaching Home is the statewide campaign to work towards preventing and ending homelessness in the entire state of Connecticut. The Partnership for Strong Communities staffs the Reaching Home campaign, and structurally the Reaching Home Coordinating Committee is designated as the COC, as the boss board. And then they delegate all the responsibilities of managing the COC to the boss steering committee. So hopefully that made sense. Hopefully that made sense. Okay, next slide. So HUD is obviously a key partner, and we have a great relationship with our field office. I think providers have a really great relationship overall with the field office and work really well together, which is huge and really, really important. So I'm sorry, I did the field office first. So Alana Cable is our office director, CPD director. And she's fantastic. She's comes to steering committee meetings, and she's really available to chat to provide feedback. HUD also has the Office of Special Needs Assistance Programs. They're called SNAPs. They call themselves snappers, which I think is fun. And they develop the rules and the scoring for the NOFO that we were talking about for the big application, where again, we got our 47 million after submitting this big application, and all the providers submitted their applications. The snappers also develop regulation notices and policies, and they provide guidance to the field office. Okay. So the steering committee. So we have a bunch of steering committee members on the Zoom today, which is exciting again. So what does the steering committee do? Well, the steering committee works to find strategies to end homelessness. They establish the CT BOSS policies. They look at data and information to decide where there are gaps in the system, and then decide we only have a finite amount of money, what should we apply for? So for example, at the next steering committee in April, we'll be voting on and talking about and then voting on which models should we allow folks to apply for. So should we prioritize rapid rehousing? Should we prioritize permanent supportive housing? Should we have both of them and folks can apply for those programs? So that's one of the things the steering committee does. They establish program targets for for renewal evaluation. So we can tell providers sort of what they should be looking towards in terms of goals. That's fine. I can move to the next one. So same thing. I think we won't do a poll, but maybe folks can unmute themselves and answer or put it in the chat box. Do you know who represents your CAN on the steering committee? And for at least one person, we have at least one CAN rep I know here. Do folks know? Anybody?
Anybody?
Oh, Shannon's gonna give some answers. No,
I'm gonna
you
help.
gotta keep going. You gotta go a couple more slides though.
Okay.
And then we can go back. There we go. They're the CAN reps, and I think we have Caitlin with us today. Do we have any other CAN reps? No other CAN reps. Well, these are the CAN reps, and we'll talk about it in another slide or two, but it's important for folks to know who these people are, because they're, again, Shannon and I are always available. You can always contact us, but if you have specific questions that you want brought to the steering committee, you can always come to a steering committee meeting. But if you want to get answers, if you want to hear what's going on in your CAN vis-a-vis the steering committee and through BOSS, these are great people to reach out to. So, and you can find these on the CT BOSS. Thanks, Melissa, put this on the CT BOSS website, which we will also need to update because we have some new members.
CT BOSS, not CT.
What was that?
This is Florian. I have it on the phone. I don't see anything, but I believe that the person we contact up here is Kim.
Yes.
From WRC.
Great.
Thanks, Florian.
Thank you. Thank you.
You're welcome.
Great. So I talked about a little bit about the structure. So this gives us a little picture. So the Reaching Home Coordinating Committee is above the CT BOSS Steering Committee in the structure. And then these are all the steering committee members, and you'll see there's a box for CAN representatives and a box for community representatives. And then the co-chairs are listed across, and then a host of folks who are partners, whether it's a not-for-profit or government entity. So this is our list of folks. Okay, next slide.
Wait, okay.
So I was talking about this a little bit before, why it's important to be in touch with your CAN rep, because your CAN rep is in charge of distributing minutes and sharing feedback, letting folks know in the CAN what's happening at the steering committee, because people can't go to every meeting necessarily, and also kind of having a handle of what's going on in your CAN and then bringing that back to the steering committee. We also may ask, or you may be involved in outreaching to providers who are struggling with HMIS or data quality, providing other information as we do community planning and decide where to allocate resources. So it's important to know who your community rep is, and we have fantastic community reps who really do a great job with this. So make sure you know who they are and you get to know them if you can. Next slide.
I'll move past to the next one.
Yeah, that's them. So now we're going to talk about the community reps who were just voted in. So, and we welcome some of them. Melissa's been with us and is fantastic and is a community rep. And we're just excited to get to know the 5 more community reps who are listed here. Okay, next slide. So we talked about you saw the list of people, the CAN reps, the community reps, and all the folks listed as the steering committee members. So what are steering committee members? What do they do? So steering committee members attend meetings, excuse me, and then also often are called on to help out with all the different things that the COC does. So we have decisions to make about the point in time count. They get involved in what's happening with HMIS. Again, planning, you'll hear us talk about planning all the time. Part of strategic planning, where should we go next? Where should we spend our money? Looking at projects, how projects are performing, and what we can do to support projects, always improving performance. Application process for different grants and funding proposals. We may call on steering committee members to help out with that. I think we've got one more slide on more responsibilities. So to really hopefully keep abreast and know what's going on in terms of gaps and needs in the COC, come to meetings, come to at least 80% of the meetings, actively participate, and then follow the bylaws and the code of conduct. Any questions? Comments, concerns? Does that make sense? Steering committee meetings are open to anyone. Anyone can come, and we'd love to have nice big crowds. I was telling Shannon, I think on Friday we had 78 or 80 people. While I'd much rather do it live and have us all be together, I do think the convenience of Zoom, cutting down on travel and making it easier for people to attend is really nice. So we love having a crowd. That you can find out more about when we have meetings on the website, but generally they are held from 11 to 12:30, generally on the 3rd Friday, but sometimes different holidays will throw us off. And if you would like to get emails telling you when we have meetings and inviting you to all different kinds of fun boss stuff, also go to the CT Boss website and you can sign up to get emails. Okay. Next slide. So more partners. We've got lots and lots of partners. The state of Connecticut, so DMAS, the Department of Mental Health and Addiction Services, they are what's called the collaborative applicant. And so they actually submit the big annual application to HUD. So they play a really important role. They also are the grantee. So they're the recipient of funds from HUD for many, many permanent supportive housing projects. I think they have over 50 projects where they are the grantee. And we'll talk a little bit more about that structure later. They provide behavioral health services. They administer, we just talked about PATH, the outreach program. And Alice Minervino is one of the COC chairs. We just talked about, so as the collaborative applicant, DMAS submits the big application. So we just talked about that. And they are the ones who are applying to HUD for those COC funds. So that's, like I said, a very, very important role. More key partners. Department of Housing. So they have a lot going on. They are the rapid rehousing grantee for a bunch of projects. They are the lead for YHDP. They also are in charge of staffing the CANs. They fund 211. They provide a lot of shelter funding through ESG. They have moving on vouchers and other affordable housing. We just talked about Unite CT, that's also under DOH, and Steve DeLella is one of the COC steering committee chairs. Okay, CCEH, the Connecticut Coalition to End Homelessness, they are the HMIS lead. They are in charge of submitting what's called the LSA, the Longitudinal Systems Analysis, and SPM, System Performance Measures to HUD. They staff the HMIS Steering Committee. They host many trainings. So like I said, it's great to Google, and I think we have a link later on to find out all the really good trainings that are going on. And they conduct all kinds of research and do analysis on a host of issues, and they do a ton of advocacy work as well in this world. Okay. There is the HMIS Steering Committee, and this committee guides what's happening with the HMIS implementation. They advise CCH and CT BOSS on a whole host of issues, and they help prioritize what's going to happen next in HMIS and where there should be attention and focus. Okay. CSH, they are with us today in Zoom, and great partners. They are a national not-for-profit, and with the CT office, they've got offices all over the nation. They promote supportive housing through training, lending, consulting, and policy reform. They are the coordinators of CLIP, and Sonia Jelks is one of the CT BOSS Steering Committee chairs, and you'll see their link later. They also have fantastic trainings and resources on their website, so check that out as well. ACT, Advancing Connecticut Together, excuse me. It's an umbrella agency that has 3 different divisions listed there, and they have a broad range of services and ensure that people impacted by HIV and AIDS have access to healthcare and housing and support services. They are the Rapid Rehousing Rental Administrator for all rapid rehousing projects, except the ones that are serving survivors of DV. CCA DV does those. They are the project manager, so they've been in charge of the HIC pit count. And John Mers is one of our CT BOSS Steering Committee chairs. And Housing Innovations, so that's us. There's a team of us, and our emails and contact information are listed later. So we staff the COC, so we provide support, we do trainings and provide technical assistance. We coordinate the HUD application that is submitted every year. We do monitoring, we evaluate renewals. We are in charge of the BOSS website, and then we partner with lots of different folks, including CCH on system performance measures. And then we partner with ACT and help out and provide support to the point in time count. And that is us. You're welcome to reach out to us at any time.
All right, I think I'm gonna take over here.
You got it.
I just want to remind everybody that there are a lot of hyperlinks on these slides with a wealth of additional information. Like when Liz was talking about CCH, for instance, there was a link to their training page, and they've done a lot of good work along with all the other providers listed. Project roles. So just a brief definition of some of the types of projects or the roles that people have as projects in our COC. We talk about grant recipients. They can be government or nonprofit entities. And what a grant recipient or grantee does is they execute grant agreements. Once you are awarded a grant, HUD sends you a grant agreement, and then you receive funding from HUD. Grant recipients oversee projects, including performance, spending, compliance. They manage any and all subrecipients. They draw down funds from HUD through a system called LOCKS. It's a recipient's responsibility to submit an annual performance report, an APR. If there are any contract amendments, that would be their job to work with HUD to make those happen. Submit or assign submission of project application, the technical submission, which is another step before actually receiving funds, renewal renewal evaluation information and things of that nature. It's also grant recipients' responsibility to keep the information current in Zengen, which is CT Boss's grant management database. Nonprofit subrecipients, they also receive HUD funding and are listed on the grants that's submitted to HUD, but they're not the primary grant. That's the recipient. These are subrecipients. The funding flows through the recipient to the subrecipient. So they report to the recipient. They may provide services to tenants and or help with housing location. They may enter data into HMIS and perform other assigned duties from the recipient. Nonprofit service providers receive non-COC funding from DEMIS. So there are some providers, they don't receive COC funds, but there are still services that need to be provided for these people to stay, for participants in projects to stay in housing, and they receive other funding from DEMIS in order to do so. They provide services to PSH tenants, may help with housing location. They enter data into HMIS and perform other assigned duties. Nonprofit housing providers administer rental assistance funding and do all the work that goes along with the actual technical renting, look at income determination, calculate rent, go to apartments and fill out the housing quality standards inspection, that type of things. They may also help with housing location. You can click on the link here to find your local LMHA or your local mental health authority. These providers offer a wide range of mental health, addiction, and crisis intervention services. They are state funded. Some are operated by DEMIS, others by nonprofits. And in some projects, the LMHA is the primary service provider for participants. In others, they're the housing provider for participants. So there are a couple different project configurations that we give you examples of here. I'm not going to talk through the details, but when we talked about, like when you saw that pie chart, there was a lot of PSH funding and DEMIS is the recipient for a lot of that funding. So here's a DEMIS grant here. So for a DEMIS grant, HUD gives the money to DEMIS, then there are several subrecipients listed on the grant. And usually those are broken out for different regions. There's a subrecipient provider for New London, for Hartford, for New Haven. All of these provide supportive services, case management services for people to stay in their housing. And DEMIS administers the rental assistance money for those projects, for those sub-projects really. Next, we're going to talk about system performance measures. I'm going to go through these last few quickly and then leave there will be some we might not get to, and I'll leave them here for your reference. And of course, if you have any questions on any of the stuff we didn't get to, please feel free to reach out to Liz or myself. System performance measures we talked about is a newer, within the last 6-7 years, requirement for COCs. And so it always has been a requirement, the annual performance report for each project, right? But this is really HUD's effort at looking at the whole system. So they look at data from outreach and emergency shelters all through permanent supportive housing. They look at items like length of time homeless, returns to homeless, the number of people entering the system, experiencing homelessness, number of new entries into the system. They look at employment and income growth, and they look at exits to permanent housing destinations. And there's a link to our results there for CT Boss's system performance measures. Oh, I advanced too. I lost my place here. Hold on. I'm going to talk about Hick and Pitt next. There we are. the housing inventory count and point in time counts are also looking at our system, but more a snapshot of our system at a single point in time. So at a single point in time, how much housing inventory do we have? How many beds in emergency shelter and all those housing components that we talked about. And usually that's counted we start counting that in the fall. And then the point in time count just happened at the end of January, and that's when it happens every year, one single night in January. How many people in CT BOSS were experiencing homelessness? And we look at that in terms of sheltered homelessness, and HUD considers people experiencing sheltered homelessness to be those in transitional housing and emergency shelter, or unsheltered homelessness, people staying in places not meant for human habitation. So examples might be staying in an abandoned building, or staying at a bus station, or staying in encampments outside. So there's an annual effort every year. And as Liz said, it's led by ACT this year, to count those people, to really look and to take stock of, are we targeting the right populations? Is the number of people experiencing homelessness diminishing? Is it rising? Those types of things. So we ask that all projects participate in it. We ask you to put data or confirm data in the PIT database. We put ACT's HIC-PIT website page as a link here. And participation in that effort is really important on the part of all of our projects. So how are SPMs and HIC data used? They evaluate our performance. As I've said, system performance measures data, impacts about 1/3 of the COC score every year. We use the data to analyze gaps. What interventions do we think are needed? Where are they needed? Who needs them? Is income going up or down? Do we need to focus more on employment services and access to employment services for people experiencing homelessness? We use the data for strategic planning to determine funding priorities and improve coordination among projects and sectors. Then I'm just going to list, there's a section on renewal evaluation. Someone was asking earlier about the HUD competition every year. So please look at that information on renewal evaluations. There's a webinar coming up next week. As I mentioned earlier, here are the links to that for renewal evaluation. Renewal applications is a process every year. Monitoring is an annual process that the COC does for a handful of projects every year, between 5 and 10 projects. For more information on monitoring, click the links on this slide. Annual performance report, there is some helpful tips on that here. And again, each project is required to submit an APR within 90 days after the project end date. Here's a slide on timelines. And then some additional resources, that some of which we've talked about already. Please look at our BOSS website, and if you have feedback on the website, especially if you're new to the COC, that's kind of a lens that's valuable to us. If you're finding things difficult to find, send us an email and let us know if you have any feedback on the website. But there are valuable resources there. There's COVID-19 resources. There's a link for Reaching Home, CCEH. And there are always opportunities to learn more.
Dana, just 1 second. Someone is asking about the timeline for the point in time count, or excuse me, for what the deadline was. Nicole, which deadlines? What was it for submitting data, or when the count takes place?
I would say most deadlines happened already, but did you have a more specific question? Let's see that. The point in time happens the last 10 days in January. And then usually within the next week to 2 weeks, everyone has to look at their data. Now we draw all of the data from HMIS, So within a week of the pit count, everyone has to go into the pit database, look at their data and click confirm. Yes, I agree. There are 10 people in my project. There were 10 people in my project on the night of the count. Click confirm. And that's the deadline for that.
Yep. Does anyone have anything else? We want to honor everyone's time, and it is 5 o'clock and we've been talking at you for 90 minutes. So,
Hello. Hi, this is Florian.
Florian.
I just have a question on the time that the point in time count is done, and I'm curious, would it not be more accurate if that was done in warmer weather? Because that's when people are actually outside and seeable.
Yeah.
And in the cold weather, they're hiding out, and it's more treacherous for outreach workers to find them.
Yes, you are not alone with that feedback. A lot of people feel that way. This is a HUD mandate. So remember, we talked about things that HUD tells us we have to do. Well, this is one of them. So HUD tells us the last 10 days in January, you need to pick one night, and that is the count. So a lot of people, it is in dispute, but we don't have a choice.
Okay.
It's one of those things, but good point, right? People bring that up, certainly. Absolutely.
Yeah.
Yeah, because you're going to find it's just a very different experience depending on the weather.
Yeah.
Any other last burning questions? I know Shannon and I both said it a few times. We really mean it. Please call us and let us know if you have a question, because this isn't easy stuff. And Shannon and I have each other and we ask each other questions all day long. It's tough and it's not intuitive necessarily by any means. And so that's our job. We're here to help. So we love feedback. Like if you look at the website and something's not right, let us know, because we're always working to improve the website and the work that we do. And we're so excited to have new faces and new folks, and we really just appreciate you being here.
I think someone mentioned they didn't have access to the slides I put in the chat. The slides are on the CT Bus website under the trainings page already. And the recording will be posted there within the next day or so.